Hi, my name is Jordyn Austin, and our project is cervical cancer screening among women with comorbidities, a cross-sectional examination of disparities from the behavioral risk factor surveillance system. I'm going to go over the results and conclusion and clinical implications, and this is Paul Delgado, and she's going to go over the background and methods.
The American Cancer Society projected that in 2020, 13,800 women would be newly diagnosed and 4,300 women would die from cervical cancer. Although research has allowed us to identify the major cause of cervical cancer, which is human papillomavirus infection or HPV infection, there are still a lot of disparities when it comes to cervical cancer screening. Implementation of prophylactic HPV vaccination screening via Papa Nicolau and via Papa Nicolau smear test has helped us reduce cervical cancer screening rates up to 80% over the past 5 decades. However, as I mentioned, there are still a lot of disparities when it comes to screening and vaccination. It is also known that due to the lower likelihood of women with comorbidities adhering to multiple cancer screening guidelines, there is a higher likelihood of disparities. Therefore, this project analyzed the cervical cancer screening rates among women with comorbidities compared to those without co-occurring diagnosis. And as you can see on the figure on the right, there has been a decrease on new cases and also death rates based on cervical cancer. Next, please. For this project, we combined the 2018-2019 behavioral risk factor surveillance system datasets with some adjusted criteria. The responses were classified based on two main questions. The first one was, have you ever had a pap smear test? And the second one was, have you ever had an HPV test? From this, we excluded women under 24 years old and over 65 from the study. And to analyze the data, regression models were constructed based on the likelihood of individuals being screened by comorbidity diagnosis and multiple comorbidities based on adjusted risk ratio. And then we conducted post hoc regression models based on the association of odds ratio, association of race via odds ratio on cervical cancer screening.
As you can see from this figure, our results showed that those with comorbidities like diabetes, depression, obesity, arthritis, chronic kidney disease, and COPD all were less likely to be screened than those without those comorbidities. And we also found an additive effect where those with 2 to 4 comorbidities were 5% less likely to be screened, and those with 5+ comorbidities were 15% less likely to be screened. In addition, there were disparities in race, and we found that Black and Hispanic women were actually more likely to be screened than white women, and those without health insurance were less likely to be screened. So there are big clinical implications in this topic because of the prevention that cervical cancer screening can provide and the decrease in mortality it can provide in terms of detecting cervical cancer early through pap smears. And as you can see, those with comorbidities are less likely to get screened. And so this is a multifaceted approach that needs to be taken, not just with gynecologic focused clinics, but also primary care and specialists, because that is where chronic conditions are typically managed. And because of the disparities with race, this shouldn't just be directed at minority communities. As we saw, white women are less likely to be screened, and our research shows that educating women on the risks and just information about pap smears can improve adherence to screening. And so that could be done with stakeholders in the community, and it can also improve adherence by sending out reminders and invitations in the mail from healthcare providers. And here's our references. Thank you.